Turn now to the journalists who have joined us this afternoon, and the first of those is Ryan Mayer from Scottish Television.
Thank you very much, Cabinet Secretary. The owner of a private care group has said this morning that they've had 3 months of mixed messages, mismanagement and missed opportunities, and they feel betrayed about the Scottish Government's handling of the Covid-19 crisis, insisting that more should have been done sooner. Can I ask what your response to this would be, and if you could say what your assessment of the Scottish Government's handling is as well?
So I want to say a couple of things to that particular owner himself. I'd be very happy to meet with him and hear what he's got to say. We could have had that conversation before now, but I'd certainly welcome it at this point. I don't believe that our messages have been mixed messages at all. We sent out very clear guidance on the 13th of March about what we were asking care home and care home providers to do to keep their residents safe. We worked on the premise, as we were right to do, that all care homes understood the importance of quality infection prevention and control and of PPE, as they should have done and will have done in previous occasions before this virus. They have encountered flu, they have encountered winter vomiting and so on. But as it became clearer to us that, for example, their private source PPE was failing, then the government stepped in to ensure that all care home providers, regardless of whether they were in the private sector or in local authorities or in the independent sector, had direct from our national stockpile the PPE that they needed, and we continue to do that. And when we realised, it was raised with us, that care home workers, who have always been in the first priority of key workers to be tested, were fearful of undertaking a test in case it proved positive and they should stay at home because their terms and conditions did not meet the government's Fair Work principles and they would see their income reduced significantly. We have stepped in to ensure that that fear is removed, and the government will ensure that those care workers in that circumstance, despite poor terms and conditions, are not faced with that almost impossible choice between losing significant income but doing what they need to do for their own health and safety, that of their families and, of course, of their residents. All of the decisions we have taken at various points throughout this period have been informed by both the advice and evidence that we've received from our clinical and scientific advisors, taking then the decisions that are informed by those and by the issues as they have been raised with us from Scottish Care, the group that represents the vast majority of care home providers in Scotland. So we have taken those decisions, the best decisions that we believed we could take in the circumstances at each step as we had that information, that evidence, and responded quickly to issues that Scottish Care have raised with us. Now, I have said before, and I won't hesitate to repeat it, that in the fullness of time, as rightly the entire country looks at the history of how this pandemic has progressed, the decisions that we've taken and others have taken, and takes a view as to whether at every stage, with what was known then, those decisions were the right decisions, that is exactly the right thing to happen in the fullness of time. Right now, my focus is on what more do I need to do to ensure that the policy that we have announced about testing in care homes, both of residents and of care workers, is being enacted throughout the country in a consistent, clear way by all of those involved. And what more, if anything, do I need to do to ensure that we continue to do everything we can, working with those providers to protect the residents